Hello and welcome back to the channel. I am Dr. Hayes Anderson. Today we are discussing a comprehensive kitchen-based protocol that can lower your blood pressure faster than many medications. This protocol takes approximately 2 minutes per day to implement, yet it addresses multiple biological pathways that control blood pressure. The reason this protocol is so effective is that it does not rely on a single intervention. Instead, it combines 7 evidence-based approaches simultaneously, all of which can be implemented in your kitchen and incorporated into your daily diet and habits. In previous videos, we have discussed individual interventions, bedtime dosing of blood pressure medication, hibiscus tea for nighttime blood pressure control, and 7 specific foods that lower blood pressure through the nitric oxide pathway. Today, we are putting it all together into one integrated protocol. By the end of this video, you will have a comprehensive system for blood pressure management that you can implement starting tonight. I will also share the story of one patient, whom I will call Dorothy, who used this exact protocol to reduce her blood pressure by 19 millimeters of mercury and reduce her medication dose under medical supervision. Her story illustrates what becomes possible when you address blood pressure management comprehensively. Foundation 1. Beet juice before bed for morning surge protection. The first component of our protocol is consuming 8 ounces of room temperature beet juice 1 to 2 hours before bedtime. This timing is critical. Beet juice contains high levels of dietary nitrates that are converted to nitric oxide by your body. This conversion process takes time. Consuming beet juice before bed ensures that the conversion is occurring during your sleeping hours and into the early morning hours when your blood pressure naturally surges. The nitrate metabolites reach peak levels approximately 6 to 8 hours after beet juice consumption, which means that they are active during the critical 4 to 10 o'clock morning window when your cardiovascular risk is highest. Additionally, the nitric oxide produced from dietary nitrates improves nocturnal dipping, helping your blood pressure fall during sleep as it should in healthy individuals. If you are a non-dipper, this effect is particularly important. Over weeks and months of regular beet juice consumption, you gradually restore more normal nocturnal dipping patterns, and your overall cardiovascular risk declines. Purchase fresh beets or fresh pressed beet juice. Do not use pasteurized or canned beet juice if possible, as the heat processing destroys some of the nitrate content. If you are using fresh beets, run them through a juicer and consume the juice within 1 to 2 hours. Add the beet juice to a glass, dilute it slightly with water if desired, and drink it at room temperature or cold approximately 90 minutes before bedtime. Foundation 2. Raw garlic and the 10-minute rule. The second component is consuming 1 raw garlic clove daily while following the 10-minute rule. This is remarkably simple, yet it produces substantial blood pressure reduction. The 10-minute rule is non-negotiable. After you cut, crush, or bruise a garlic clove, you must wait at least 10 minutes before consuming it. During these 10 minutes, the enzyme alliinase is converting the precursor compound alliin into active allicin. Allicin is metabolized by your body into hydrogen sulfide, a potent vasodilator that relaxes your blood vessels. If you consume the garlic immediately after cutting without waiting, the enzyme does not have time to work, and stomach acid inactivates the enzyme before it can complete the conversion. You do not receive the blood pressure lowering benefit. The 10-minute wait is what transforms garlic from a spice into medicine. A practical approach is to crush your garlic clove at the beginning of meal preparation. By the time you finish preparing the rest of your meal, 10 minutes or more have passed. Add the crushed garlic to your salad, soup, vegetable side dish, or other prepared food. The timing fits naturally into your cooking routine, and you do not need to do anything extra or inconvenient. Foundation 3. Eliminating the antibacterial mouthwash saboteur. This component is actually subtractive rather than additive. Many people do not realize that antibacterial mouthwash actively sabotages blood pressure control by reducing nitric oxide production by approximately 25%. This is a profound effect. If you are consuming beet juice, arugula, and other nitrate-rich foods, and simultaneously using antibacterial mouthwash, you are working against yourself. You are trying to enhance nitric oxide production while actively reducing it. Antibacterial mouthwash kills the beneficial bacteria in your mouth that are responsible for converting dietary nitrates to nitrite, a precursor to nitric oxide. Additionally, antibacterial mouthwash disrupts your oral microbiome, which plays a surprisingly important role in your overall health and cardiovascular function. Replace antibacterial mouthwash with a gentle, non-antibacterial alternative, or simply eliminate it entirely. Brush your teeth thoroughly with a quality toothbrush and fluoride toothpaste. Floss daily, but do not use antibacterial mouthwash. By making this single change, you immediately restore 25% of the nitric oxide production capacity that you were losing. Foundation 4. The mineral trio for blood vessel function. 3 minerals are essential for blood pressure regulation: magnesium, potassium, and nitrates from leafy green vegetables. When these 3 minerals are present in adequate quantities, your blood vessels function optimally and your blood pressure is well controlled. When any of these 3 is deficient, blood vessel dysfunction occurs and blood pressure rises. Magnesium is the mineral that activates hundreds of enzymatic reactions in your body, including many that regulate blood pressure. One of the most important functions of magnesium is stabilizing cell membranes and regulating calcium movement in and out of cells. This is particularly important in blood vessel smooth muscle cells. When magnesium is deficient, calcium accumulates inside smooth muscle cells, causing them to constrict. When magnesium is adequate, calcium remains in balance and muscles remain relaxed. Excellent sources of magnesium include leafy green vegetables like spinach and kale, pumpkin seeds, and almonds. Aim for 300 to 400 milligrams of magnesium daily from food sources. Potassium works synergistically with magnesium to regulate blood pressure. Potassium activates the sodium-potassium pump, which removes excess sodium from your cells and reduces fluid retention. It also improves the elasticity of blood vessels. Excellent sources of potassium include avocados, sweet potatoes, spinach, and other leafy greens. Aim for 3,000 to 4,000 milligrams of potassium daily from food sources. One medium avocado contains approximately 500 milligrams, and one medium sweet potato contains approximately 530 milligrams, so it is easy to reach adequate potassium intake. Nitrates from leafy green vegetables work directly by being converted to nitric oxide in your blood vessels. Spinach, arugula, kale, and other dark leafy greens are concentrated sources of dietary nitrates. Consume at least 2 to 3 servings of raw leafy greens daily, either in salads or blended into smoothies. The raw preparation is important because cooking destroys some of the nitrate content. A simple kitchen habit for obtaining all 3 minerals is preparing a salad containing spinach or arugula, sliced avocado, and a sprinkling of pumpkin seeds or almonds. This single salad provides magnesium, potassium, and dietary nitrates in one convenient meal. Consume this salad at lunch or dinner at least 5 days per week. Foundation 5. Vitamin C for nitric oxide stability. Vitamin C plays a critical role in protecting nitric oxide from oxidative degradation. Nitric oxide is inherently unstable and is destroyed by free radicals and reactive oxygen species. Vitamin C is a powerful antioxidant that neutralizes these free radicals and prevents nitric oxide from being destroyed. This allows the nitric oxide your body produces to remain active and effective for longer periods. Additionally, vitamin C is a cofactor for the enzyme that produces nitric oxide from nitrates in your blood vessels. Without adequate vitamin C, the conversion process is less efficient. 1 medium red bell pepper, contains approximately 190 milligrams of vitamin C, which exceeds the recommended daily intake for most adults. One orange contains approximately 70 milligrams. By consuming one red bell pepper or 2 oranges daily, you provide your body with ample vitamin C to protect nitric oxide and support nitric oxide production. Red bell peppers have a sweet flavor and can be eaten raw as a snack, added to salads, or included in cooked dishes. The vitamin C content is highest when peppers are consumed raw, though substantial vitamin C remains even after light cooking. Foundation. 6. Omega-3 fatty acids for anti-inflammatory effect. Chronic inflammation is a fundamental driver of hypertension and cardiovascular disease. One mechanism by which blood pressure medications work is through reducing inflammation in blood vessels. Omega-3 polyunsaturated fatty acids have powerful anti-inflammatory effects. Additionally, omega-3 fatty acids improve blood vessel flexibility and reduce blood clotting tendency, both of which contribute to blood pressure reduction. Fatty fish are the richest source of omega-3 fatty acids. Salmon, mackerel, herring, and sardines contain high levels of icosapentaenoic acid and docosahexaenoic acid, the most bioavailable forms of omega-3. Aim to consume fatty fish at least 3 times per week, with 2 to 3 ounces per serving. If you do not like fish, omega-3 can be obtained from flax seeds, chia seeds, and walnuts, though the bioavailability is lower than fish sources. 3 tablespoons of ground flaxseed or chia seeds provides approximately 3,000 milligrams of alpha-linolenic acid, a plant-based omega-3 that your body can partially convert to the more active forms. Integration. Putting all components into daily routine. You now have 6 components, each of which targets blood pressure through different biological mechanisms. The beauty of this protocol is that they can all be integrated into a simple 2-minute daily kitchen habit. Here is how to implement this systematically. In the morning, drink 8 ounces of room-temperature beet juice upon waking. This takes less than 1 minute. The beet juice is now active and will be converted to nitric oxide over the following hours, providing protection throughout the day and into the critical early morning surge period of the next day. At lunch, prepare a salad containing spinach or arugula, 1/2 of an avocado, and 1/4 cup of pumpkin seeds or almonds. This salad provides magnesium, potassium, dietary nitrates, and omega-3 fatty acids. Consume this salad at least 5 days per week. Preparation time is approximately 5 to 10 minutes, but you can prepare multiple salads at once on the weekend to save time. In the afternoon, consume 1 medium red bell pepper, either raw as a snack or added to a dinner preparation. The red bell pepper provides vitamin C for nitric oxide protection and stabilization. At dinner, crush 1 raw garlic clove at the beginning of meal preparation. Wait 10 minutes while you prepare the rest of the meal. Add the crushed garlic to your dinner, which can be a salad, vegetable side dish, or other prepared food. This provides the allicin that is converted to hydrogen sulfide for blood vessel relaxation. 3 times per week, prepare a dinner containing a 2 to 3 ounce serving of fatty fish, such as salmon or mackerel. The omega-3 fatty acids provide anti-inflammatory effect and improve blood vessel flexibility. In the evening, 1 to 2 hours before bedtime, drink 8 ounces of hibiscus tea prepared according to protocol, 10 grams of dried flowers, water at 90 degrees Celsius, 15 minutes steep time, resulting in deep burgundy color. Stop using antibacterial mouthwash immediately. Replace it with a non-antibacterial alternative or eliminate it entirely. This is the only subtractive component, but it eliminates a major saboteur of your nitric oxide production. Patient story. Dorothy's success with comprehensive protocol. Let me share the story of one patient, whom I will call Dorothy, to illustrate what becomes possible with this comprehensive protocol. Dorothy was a 74-year-old woman who had been diagnosed with hypertension 15 years earlier. She was taking 3 blood pressure medications, an ACE inhibitor, a calcium channel blocker, and a beta blocker. Despite taking these medications faithfully, her blood pressure remained elevated at approximately 145 to 150 systolic. She had experienced one prior heart attack 8 years earlier and had 2 stents placed in her coronary arteries. She was terrified of another heart attack and wanted to do everything possible to prevent one. When Dorothy came to see me, I ordered an ambulatory blood pressure monitor and discovered that she was a severe non-dipper. Her daytime blood pressure averaged 138 systolic, which was reasonably controlled by her medications. However, her nighttime blood pressure averaged 142 systolic. She was not experiencing adequate nocturnal dipping at all, and her nighttime blood pressure was actually higher than her daytime blood pressure. This elevated nighttime pressure was putting continuous stress on her cardiac tissue and blood vessels. I explained the research on bedtime dosing and the comprehensive protocol we have been discussing. Dorothy was skeptical at first. She believed that her medications were handling the problem and that adding foods and beverages to her routine could not possibly make a meaningful difference. However, I encouraged her to try the protocol for 3 months and then reassess. Dorothy began consuming beet juice each morning. She prepared her mineral-rich salad 5 days per week. She consumed 1 red bell pepper daily. She implemented the 10-minute garlic habit. She began eating salmon 3 times per week. She switched her ACE inhibitor dose to bedtime. She stopped using antibacterial mouthwash and began drinking 3 cups of hibiscus tea daily, with special attention to the evening cup. She also began sleeping on her left side instead of her right side to optimize blood vessel function during sleep. At her 3-month follow-up visit, I obtained repeat blood pressure readings and a repeat ambulatory blood pressure monitor. The results were remarkable. Her daytime blood pressure had fallen to approximately 132 systolic. Her nighttime blood pressure had fallen to approximately 128 systolic. Overall, her average blood pressure had dropped by 19 millimeters of mercury. Most importantly, she had begun to develop more normal nocturnal dipping. While she was not completely normalized, her nighttime blood pressure was now 7 to 10 points lower than her daytime blood pressure, indicating that her autonomic nervous system was beginning to regulate nighttime blood pressure more appropriately. Based on these improved readings and improved dipping pattern, under Dorothy's physician's supervision, her medication regimen was adjusted. Her beta blocker dose was reduced by 50%, and her calcium channel blocker dose was reduced by 25%. She remained on her ACE inhibitor at the same dose, now taken at bedtime. She was able to reduce her overall medication burden while achieving better blood pressure control than she had with higher medication doses. More importantly, she felt better. She had more energy, she was sleeping better, and she no longer experienced the side effects of beta blocker therapy, which had previously caused fatigue and exercise limitation. Dorothy's case illustrates a crucial point. When you address blood pressure management comprehensively, targeting multiple biological pathways simultaneously, you achieve outcomes that are not possible with single interventions. She did not reduce her medications and improve her blood pressure control by taking one food or making one habit change. She did so by making 6 or 7 coordinated changes that address the underlying biology of blood pressure regulation. Her story demonstrates that this protocol is not theoretical. It has real, measurable effects on blood pressure and cardiovascular health in actual patients. 7-day starter protocol revisited. Based on everything we have discussed, here is a complete 7-day starter protocol that you can implement immediately. Day 1. Begin consuming 8 ounces of room temperature beet juice upon waking. Begin consuming 3 cups of hibiscus tea daily, with the evening cup 1 to 2 hours before bedtime. Discard any antibacterial mouthwash and replace with a non-antibacterial option or discontinue entirely. Begin sleeping on your left side if you are currently sleeping on your right side. Day 2. Continue with Day 1 activities. Begin preparing a mineral-rich salad containing leafy greens, 1/2 avocado, and seeds or nuts. Plan to consume this salad at lunch at least 5 days per week. Day 3. Continue with days 1 and 2. Begin consuming 1 medium red bell pepper daily as an afternoon snack or at dinner. Day 4. Continue with days 1 through 3. Begin implementing the 10-minute garlic protocol. Crush 1 garlic clove at the beginning of dinner preparation. Wait 10 minutes. Add it to your prepared food. Day 5. Continue with days 1 through 4. If you currently take blood pressure medication, discuss with your physician the possibility of switching to bedtime dosing. Days 6 and 7. Continue with all previous components. Plan your meal preparation for the week ahead, including 3 servings of fatty fish for the coming week. By the end of 7 days, you will have implemented a comprehensive, evidence-based protocol for blood pressure management. After 4 to 6 weeks, you should return to your doctor for a blood pressure check. If available, request an ambulatory blood pressure monitor to assess your dipping pattern. Many patients experience 5 to 15 millimeter reductions in blood pressure within 1 to 3 months. Some patients, like Dorothy, experience even greater reductions. Conclusion: empowering yourself through evidence-based kitchen medicine. You now possess a comprehensive protocol for blood pressure management that is evidence-based, safe, and highly effective. This protocol does not require expensive supplements or exotic ingredients. Everything in this protocol is available at any grocery store. Every component is backed by rigorous scientific research. Every component is safe for seniors, and every component has the additional benefit of improving overall health beyond blood pressure reduction. The key insight is that blood pressure regulation is not the job of medications alone. Your body has intricate systems for regulating blood pressure through the nitric oxide pathway, the renin-angiotensin-aldosterone system, the autonomic nervous system, and hormonal regulation. By supporting these systems through food and lifestyle, you optimize your body's ability to regulate its own blood pressure. You reduce your dependence on medications. You extend your life and improve your quality of life. Thank you for watching this comprehensive presentation. Please subscribe to our channel for more evidence-based health information. Share this video with friends and family who are struggling with blood pressure, and please consult with your personal physician before making any changes to your medication regimen. I am Dr. Hayes Anderson, and I will see you next time.